The opinions expressed in this podcast are those of the host and guests and don't necessarily reflect the views of WOWT.
Welcome to another episode of the Becca's Talking Podcast. Thank you for joining us here every Tuesday, a brand new podcast. And I have to do the obligatory mention. Please like us on our Facebook page, subscribe to the YouTube channel, or any of the other audio channels that we're on. We're on Spotify and iHeart and iTunes and whatever else is out there. So do all of that stuff, and please spread the word about the podcast. That's brought to you by Havana Garage in the Old Market. Havana Garage, which is just, a fun place to go. And I would say fun. It's fun in that it's enjoyable. You can go relax, have a conversation with your friends, solve the problems of the world with a cocktail and a cigar. It's got kind of a nice vibe to it. It's got that whole vibe of the Rat Pack, with Dean and Sammy and Frank and all those guys, right? And Eric, you're nodding your head. It sounds like you've been to the Havana Garage.
I've been to the Havana Garage. I've had a great time, and I've solved all the world's problems with me and my buddies. We've done it. We've done it there.
I'll tell you what, you are not. I have had so many guests. I had so many guests on this podcast. When I mentioned Havana Garage, they're nodding their head. Oh yeah. So anyway, stop by Havana Garage and tell them you heard about it on the Becca's Talking Podcast. My guest is Erik Servellon. I know I was going to mess it up. Servellon.
You got it.
All right, Erik
Servellon.
He is the Development and Communications Director at One World Health Center. Now, what is One World Health Center? I mean, I've seen One World Health Center. I've seen the signs. You've got locations all over town.
Yep, sure do. And I hear so many people, just like you hear people talk about Havana's Garage. You hear a lot of people say, "Oh yeah, I know about One World." Yeah. So One World Community Health Center it's a community health center. It's also a federally qualified health center. So all that means is that we've gone through the accreditation and we've gone through the whole process of getting qualified, accredited at the federal level to serve the population that we serve now. So our big mission is really about getting healthcare to those that need it, regardless of their ability to pay, their financial status, their socioeconomic status, religion, creed, diversity, thought, whatever it is. We don't care. If you're human, come on out and get good quality healthcare.
How is that different than, let's say, from any other medical facility in town?
The biggest thing is our focus on that population that has that inability to pay. So I'm going to tell you about 53,000 unique patients last year. And from those, about 40% of them were uninsured. So when you come to One World, you're uninsured, you don't have the ability to pay, we're not going to turn you away. We're gonna get you the help that you need. We're going to give you the primary care that you need. So think family medicine, pharmaceuticals, dentistry, things like that, and behavioral health. And we're going to say, hey, you know what? If you can't pay, just make sure, let's get it documented. Don't worry about it. We want to make sure that you get the health care.
Well, then where do you get your money?
So we are very fortunate. So different pots. We're very fortunate to have a philanthropic community that is very supportive of our work. We literally can't do it without them. And we also get a big chunk of it. About, I would say 40 to 50% of it is Medicaid reimbursements. Medicaid, we rely really heavily. That's another about 40% of our population base is simply Medicaid. And then about 15% are private insurance. So we get a little bit of help from everybody.
Now, I have a friend who actually One World helped years ago. She had colorectal cancer, which involved surgery and everything. So you don't do surgery there at your facilities,
no,
right? No,
we don't.
So you worked with the local hospitals and everything. At the time, she didn't have health insurance. She couldn't pay the whole bill.
Yeah.
And you guys were there for her.
Love it.
Yeah.
Love it.
What about the other facilities? Like, if this cancer patient goes to Methodist or UNMC or Nebraska Medicine or CHI or whatever, how do they get paid in all of this?
So that's a great question, because we have a lot of folks that get referred out to specialty care. At One World, we focus on that primary care. So we're going to get that family medicine, that women's clinic, the pediatric patients, and we're going to give you the primary care that you need. If you're sick, or if you need a wellness check, or maybe your teeth aren't doing too great. But we got to the point where sometimes when there's a specialty like oncology or what have you, we refer them out. and then they go through their process. And we have these partnerships with all these community folks and all the health centers, the CHIs, the Common Spirit now, the Methodist, what have you, and they go through their process. So if maybe they're on we call it a schedule of fees or a fee schedule, if they don't pay us, and we'll continue to not charge them. However, whatever the policy is at wherever we refer them, they have to deal with them.
There's been so much, you mentioned Medicaid. There's been so much talk lately about cutting back on the number of people that get Medicaid and cutting back on financing like that. It's probably too early in the process for you to have noticed much of a hit on that as of yet, because the bill hasn't passed and everything. But at the same time, you've got to be concerned about what the mood is right now in D.C. when it comes to you being able to help those less fortunate.
That is one of the big questions of the day, is what's going to happen with with Medicaid. And I think a lot of folks are starting to understand is how many Nebraska residents, how many Nebraska people that are Nebraskans rely on Medicaid and rely on federally qualified health centers, because we're one of 7 in Nebraska that rely for their primary care. And when we look at what is being tossed out there and maybe the uncertainty that's at the federal level, when we start looking at Medicaid is going to be cut, we don't see it as we're going to lose money. We see it as we're not going to be able to help the patients that need that help. And that's tens of thousands of people that I don't know what numbers you're seeing out there, but what I'm seeing is if the cuts go through the way that it is currently written in the continuing resolution that the House recently passed, if that goes through, you're going to have tens of thousands of Nebraskans that are not going to be able to have their health care paid. And for us, we're not going to turn them away. But we're also an organization, we're a business, a nonprofit business that has to pay our bills too, and that's going to impact us. So it's like a slippery slope, and it's a rock, whatever metaphor you want to use, it's a snowball rolling downhill, where we're not going to turn people away, but then we're not going to get reimbursed. So maybe we have to let go of staff, or we have to think about how we're going to maximize our efficiency here, and then that's going to hurt how many patients that we can see every day. So, I mean, it's something that we're paying very close attention to. It's also something that we're imploring and asking our delegates at the federal level, our senators, our House reps, telling them, fight for the healthcare access for Nebraskans. Fight for keeping Nebraska healthy. Medicaid is one of the best ways to do it, and let's make sure that we prioritize that.
You say that you focus on people that are economically challenged, can't afford to pay. People in that also the Hispanic community. Your locations are primarily in South Omaha, are they not?
The majority of them are. So we are very proud to own the Livestock Exchange building, historic building in South Omaha. That is our main campus, and we have 18 clinic locations all over the greater Omaha area. I love talking about One Worlds because everybody knows it as the South Omaha Clinic, or at least one of the South Omaha clinics. And we've expanded to encompass just about the greater Omaha community. We're in Plattsmouth, Bellevue, where we get patients from 80 zip codes all over the city and all over the state in Iowa, and even as north as South Dakota and as south as Kansas. People are coming to us because our quality of care is actually just as good as any other health system that's out there. And going back to your original question, so we had 53,000 unique patients last year. 97% of them are at the 200% or below federal poverty line. So it's people that are going to have weekly questions about how am I going to pay for healthcare? How am I going to pay this bill, or am I going to get medicine? Things like that. Out of that same population, 70% of them are Hispanic Latino. So people like me, my parents immigrated from El Salvador back in the late 70s, early 80s. I was born in Los Angeles, moved to Omaha as a kid. I grew up in South Omaha. One World was the clinic you went to. That's the place that you got help. And it's something that has grown to something that we have this mission for South Omaha, and we understand that poverty, it's everywhere. It's not just in South Omaha. It's in North Omaha. It's in East Omaha. It's in Ralston. It's even in West Side, where we're actually starting to look at what can we do to help the West Side residents. And when you start talking about rural Nebraska or areas outside of Omaha, there's a need there too. And so, I mean, the need is very apparent, and we're just We're glad that we're able to be in a position where we can expand and serve those that need the healthcare. And we're always thinking, how can we do more?
Now, like I said, you primarily deal with the Hispanic population, the South Omaha population. Charles Drew is in North Omaha. Is it? I mean, I know you're not a spokesperson for them, but is it a similar thing with Charles Drew, or do you guys work together, or how does that all come together?
I was having lunch with one of their directors recently, and we were talking about, oh man, there's enough work to go around. There is enough people that need community health centers that are in their neighborhood. I'm a big believer in bringing the healthcare into the community, and we were talking about there's so much to go around, and how can we work together? How can we collaborate? Because we like to talk about North and South Omaha. I like to think about it as East Omaha. Better yet, I like to think of it as all of Omaha. And so when it comes to that, I definitely don't see any other community health centers. We're helping each other out meet this need. We're more collaborators than competitors, and I think that's the way that we should be looking at this issue.
One of the reasons why I wanted to talk to you about this is because, people, when they focus on the news and they hear the news and they hear about people on Medicaid, and politicians make it sound like these are people that, aren't working. As a matter of fact, in that new bill, that's all part of it. You've got to be working at least, I think it's 20 hours a week to, qualify and all that stuff. But a lot of your people that you'd see are working poor, are they not?
They are. They absolutely are. And with that fee schedule that I talked about earlier, and paperwork that we have to do, we ask them to provide proof of income. It's like, show us your pay stub, and we use that. We actually document that, hey, they are working, but they're just not making enough to be able to pay all the bills. And so they absolutely are. And Medicaid, for so many people, it's that supplement that helps them work and stay healthy. And if they don't have that Medicaid, then they're not going to they're going to get sick, and they're not going to be able to show up that day. So it's Medicaid is only, sometimes I think it's only seen as a healthcare issue, but it's actually an economic boost for folks, because that means that I can get the meds that I need, and I can report to work and earn an honest living. So you hit the nail on the head there. There are so many folks that are our patients that are just working and doing their part to just live the American dream.
Yeah. I've been very fortunate. I've got a few bucks in the bank. I've got good insurance.
Good.
If I went to One World, would you take me, or would it be a thing like, hey, you know what, Tom? Why don't you go to, to another doctor, because we're dealing with people here that maybe, have no other options.
Yeah. Tom, that is fantastic question. I love that you ask that question. And I love when people ask me that question, because it lets me give you two answers. It lets me tell you, yes, please come to One World. Because for every one private insurance person that we get, we're actually able to pay for two uninsured folks. So you're able to help your community out by just getting the healthcare that you need. And the second piece goes back to something I said earlier. The quality of care at One World is just as good as any other health system in the area. You're not gonna miss anything out when you come to One World, and you're gonna be, and because sometimes there's this preconceived notion that One World is only for a certain population. It's you only go there if you have no other means. That's farther from the truth. We have great dental facilities. We have some dentists here, like they tell us, we have better offices than we have at some of the private offices around town. And you're going to see doctors that are passionate about the community, and they do just as damn good job, excuse my American, as any other doctor out there. And they're going to have that extra bonus that they're there for a very mission-driven, reason. Now,
do the doctors actually work for One World, or is this sort of like a Doctors Without Borders sort of a thing, where they come in and on Tuesdays they volunteer, and that's or are these like physicians and nurse practitioners and that actually work for One World on a regular basis?
Actually work at One World. Yeah, we started back in the 70s. We started as a volunteer clinic, but now we are we have our contracts and paid employees, and we have 500 FTEs, over 500 FTEs, over 500 staff that work, and dozens of those are doctors and nurse practitioners and physician assistants. And no, they're paid full-time staff.
As I said, I wanted to maybe humanize this a little bit for some
Please.
people because again, you see it on the news, and if you're living in you got a nice life, you're living your little circle of friends, you may not be aware of the population that needs this type of help, and be aware of just what these families are going through that can benefit from One World. Right now, there's immigration raids.
Yeah.
Do you check legal status when somebody comes to One World?
I'm proud to say that we do not check immigration status at One World. We don't care about your immigration status. If you're a human being that needs health care, come to One World. We are we take patient confidentiality very seriously. And so we don't even check that paperwork because all we care about is your health. We care about your health. And that's such a great question. And I love that you want to talk about the human aspect of it. Like I mentioned earlier, my parents came over from El Salvador, late 70s, early 80s. They were fleeing the civil wars and unrest that's happening over there. They are the epitome of, they wanted to live that American dream. They wanted to give people like me, a first generation American, an opportunity to be something, reach my full potential. And like yourself, I'm in a very privileged position now where I have a few bucks in the bank, private insurance. I have discretionary income, and it's because of the risk that they took, and then working at sweatshops in Los Angeles, and then working labor jobs here in Nebraska when the time came when we were over here. And they are so emblematic of just about every single immigrant that I run into. I've yet to run into in my entire life, what sometimes the news media or maybe politicians use to demonize immigrant folks. Yeah, I don't know where they are. All I run into are good, honest human beings trying to do their best.
I come from, was born in Cleveland, and I come from a Czechoslovakian family, a good bow hunt family, where gravy was a beverage, that sort of a thing. I mean, it was, but my great grandparents came over on the boat, and then they raised their kids. My grandfather wound up being a city councilman in Cleveland. First generation, he ends up as a city councilman. Yeah, his kids have all done well, right? My dad and his brothers. They all did very well. And, I've had a pretty good life myself. Yeah. This is the American dream. Yeah. And what you're talking about, a lot of people that you deal with there, in your own experience, the American dream. Yeah.
You are, again, you hit the nail on the head there. Whenever I relate my story, there's folks that are like, oh, it's just a repeat of what my family went through when they came over from Czechoslovakia or Poland or name the country. Right. Name the country. That they come over and all they're trying to do is provide for their family, have home, shelter, have a healthy life, have a happy life. All they're trying to do. And now I think right now it's Latino Americans' turn, if you will. I don't even know if everybody gets a turn or something, but it's now our opportunity to do just a little bit better in life. Just a little bit better. And that's what, and I take that very seriously. I put the responsibility on myself to pay this privilege forward. To make sure that when I start raising my family, that I raise them up to be good human beings, good community servants, that are civic minded, because of the opportunity that my parents, and that opportunity came with a lot of sacrifice. You're talking about the ICE raids happening. I mean, I don't know if you've seen the photos going out already, but it's people that are families are being separated, and all they're trying to do is what your family did, what my family did. And I mean, it's just a shame to see those kind of photos out there right now.
It really is. And, granted, look, in any culture, I don't care, what, any culture, there's going to be some bad eggs. Yeah. And if they're bad eggs, then they should be punished to the full extent of the law. No doubt about that. I think everybody can agree to that. But we're getting people here that their only crime is that they weren't born in America. And it's not like all of a sudden after these, I don't get on my soapbox here for a second. It's not like all of a sudden that all of these packing plant jobs are going to be, and the roofing jobs are going to be taken over by white Anglo-Saxons, right? I mean, that's just realistic, I mean, and these politicians use the Latin community right now, or any minority at that point, as basically dividing something to divide us. And you know what? I don't care. I don't care if you were born in this country, not born in this country, if you're white, black, Hispanic. Everybody gets sick. Everybody needs health care.
Yes, absolutely.
Everybody needs a chance to have a decent job and raise a family.
Yeah.
You know, and that's what this country's supposed to be. And it worries me that we may be losing some of that.
Yeah, and you're not alone in that worry. I think there are a lot of people that from both sides of the aisle that are starting to wonder out loud: Are we losing that the spirit of what the United States is supposed to be? Are we losing grasp of that social contract of the American dream? Are we they're starting to question, I think, the right questions. Are we going in the right direction as the United States of America, where we were founded by immigrants, literally? And there's a lot of history that we'd have to talk about since then. But in today's age, we should be the most welcoming country. We should be the country where, come on over. If you're a good human being, if you're not one of those, like you're saying, those bad eggs, come on over and contribute to the beauty that is our country and our nation. And you know what? If you want to work the labor jobs, awesome. If you want to work the labor jobs to set up your kid to maybe one day become a director at a nonprofit like I am today, then do that too, et cetera, et cetera, et cetera. So I love that you got in that soapbox, and something that you mentioned there about the healthcare piece, and that's why we exist. So in the 70s, when it first became One World became a volunteer clinic, when it first started, it was because there was a Native American kid that was going to go without a life-saving surgery. And the doctor said, I mean, all I have to do is reach out and be the doctor for this kid. And wait, there's other kids that also need our help. Well, then let me just do my part to help those children, that community, be the best Americans that they can be the best residents and citizens that they can be. And that's the spirit that we continue now. We provide this quality healthcare for those that are just trying to make it in life. I mean, it's a beautiful mission. It's one that I'm very proud to be a part of.
And if people take care of their health early on, it saves a lot of money further on down the road.
Compounding interest. And also, I'm a veteran as well. I served 14 years in the Nebraska Army National Guard, 7 years as a clinic medic, 7 years as a flight medic, with one deployment to Afghanistan. And in those 14 years, I got beat up. So sometimes I'll go to the VA and I see a lot of my veteran community there that they weren't able to, or maybe their condition didn't allow them to get the healthcare earlier in their life. And I made the commitment to myself, I'm going to take charge of my healthcare, of my health. I'm going to take charge of my health to make sure that I set myself up and my family up for success, where I have a terrible back. Well, I use the VA to manage that, which allows me to go to work, which allows me to live a fulfilling life, which will allow me to be a great dad, a great husband. I mean, healthcare is it's one of those where you don't know how bad a sickness is until you have it, or how much you use your back until you hurt it. You don't realize how much your healthcare affects everything that you do.
I hear medical marijuana can help with that back pain, but that's another podcast for another day.
That's another podcast.
That's another podcast for another day. I want to take a quick break here for Havana Garage. One more time, remind you about Havana Garage in the Old Market. You know, it's summertime. They got a nice little outdoor patio there. You can sit out there and enjoy it. I was out at Havana Garage the other day with some friends. We were just sitting outside and laughing and having a cocktail and a nice little single malt scotch. They've got a great selection of whatever you like to drink. They'll have it for you there at Havana Garage. A nice atmosphere. Yeah, you don't have to smoke a cigar to enjoy it. You don't have to. You just go and relax. Take it easy. Solve the problems of the world at Havana Garage there in the Old Market. So a few minutes left on this with One World. What's the future hold for you guys? Or is the future sort of in limbo right now with all the talk in D.C. about cutting budgets and everything? Or do you have plans for future growth?
Yeah, I mean, that's a great question. Something that Andrea, our CEO, is, whatever happens at the federal level, the mission and the people are still going to be there. There's still going to be human beings in Omaha and in Nebraska that are going to need healthcare. They're going to need our help. So we can't be thinking about what if this goes away or that go away. The need is going to stay. Something that we're very proud to be working on right now. We actually had a groundbreaking on our new behavioral health outpatient clinic. That's going to be in South Omaha. We just did the groundbreaking about a couple of months ago. We did a survey and it was very loud and clear. Behavioral health, we need it in South Omaha. And so we broke ground thanks to generous donors, very generous philanthropic community, and also help from that North and South Omaha investment money that came through the state. So we were able to get that off and running. And here in a couple of years, we'll have this new building that's going to be a mental health outpatient clinic, but it's also going to be childcare, early childhood development center, and a workforce training center all in one building. And then beyond that, another thing that we're starting to cook up is One World 2030. What does it look like for One World to be serving the greater Omaha community in the future? Me personally, I think that healthcare is something that's it's something that's gonna be on everybody's top of mind. It's gonna be on everybody's mind for the rest of humanity. And the need for access to healthcare is only gonna grow in Omaha. As we grow into a larger city that we are now becoming, we're going to have a population that's going to be uninsured or is underinsured, or maybe doesn't have the ability for some reason to pay for the healthcare. That's only going to grow. The need for One World and community health centers in general is going to grow. And that's the kind of vision that we're thinking about right now, is how is One World going to meet that need? And we need to get ready now. Maybe not the best environment, this uncertain federal policy environment that we're in, to be thinking that way, but we have to, because we can't be behind the ball when the time comes.
You say what, 53,000 separate patients last year?
Unique patients, over hundreds of thousands of visits.
Okay, so I'm a new patient.
Yeah.
I need to go get a checkup. How long of a wait is there? I mean, there's a wait, in the other healthcare facilities. Yeah. Is there a long wait at One World too?
You know, I'm going to give you two answers. I'm going to give you the truth, and I'm going to give you the honest truth. There is a wait. We need more nurses, doctors, physician assistants than what our current capacity has. The need is larger than our capacity to meet. And right now, if you're a new patient, you can expect to wait anywhere from 2 to 3 weeks, which is not too long. That's actually not too bad for the general healthcare. But a follow-up visit might take a little bit longer. It might take 2 to 3 months. And that's something that we're actively looking at. Okay, how can we fix this issue? Because we know it's an issue. And it's not just doctors that we need. It's not just nurses that we need. Although that's a primary focus for us, is what are the support services that are around, the schedulers, the front desk people, the nurse, the CNAs and such. How can we build a revenue stream that allows us to grow our support staff and our doctor base to be able to meet the need that is already here? And that's not even talking about that expanded need that we just talked about earlier. So there is a bit of a wait. We are a community health center. We operate on a model that we serve those that have the inability to pay. So you know what? This is a great opportunity to ask those that if they want to support our work to please reach out. Please reach out, support our work. We're a nonprofit.
So you do take donations?
We absolutely do. We take donations, and every dollar helps, and we rely heavily on grants and such. So, any organization or any listener that thinks this is something they want to support, I would ask them to do two things: donate online, oneworldomaha.org, or go ahead and reach out. If you're part of a business that wants to sponsor one of our events, we have health fairs, we have dinners, we have the whole nine, all the different events that a nonprofit might have. We have those too. And if our values align, our mission aligns with what you want to do in the community, help us out.
All right. Once again, the website address is?
It's oneworldomaha.org.
Oneworldomaha.org. Yeah, I mean, healthcare, it's important for everybody. And I've seen the One World. I know a person that works for you, and I also had a friend of mine, like I said, that benefited from you. And yet I didn't know that much about all that you do. And I had no idea that you were seeing that many people and that many locations. Yes. And by the way, it's also because you think, okay, I don't have my blood pressure checked or my blood tested. but it's also you're dealing with mental health and dentist
behavioral health,
work
dentist,
and all physical therapy. And
We don't have physical therapy, but we do have pharmacy. We have pharmacy in-house, one of the busiest pharmacies actually in Nebraska. Behavioral health. We actually even have a WIC office. We have a WIC office inside of our building, a social work department that's in-house. And behavioral health, like I mentioned earlier, primary health, and then also women's clinic. That's another big one. Pediatric dentistry is probably one of our busiest, most sought after services. So we're a little bit of everywhere. And like you mentioned, so many patients, 18 clinics. We have 2 mobile clinics that are for primary care, and then 2 more mobile clinics that are specific for dentistry, we also have 5 school-based health centers where we actually have a clinic inside a school. Shout out to OPS and our newest clinic over at Buena Vista High School, where we actually bring the healthcare into the schools. So we're out there.
Wonderful. Yeah. Thank you very much.
Thank you for having me. It's been great.
It's been interesting. It's an issue that really, quite honestly, everybody's dealing with right now. When you look at the Medicaid expansion or lack thereof, when you talk about healthcare in general, when you talk about immigration, so much of that all ties into this one topic here. And when it gets right down to it, we're all people. We're all human beings, and
we're all in it together.
And we all want what's best for ourselves, our families, and just because somebody else does well doesn't mean that I don't. That again, I'll get off my soapbox here. Thank you very much, Erik. Nice talking with you.
Thanks,
Join
Tom.
us every single Tuesday, or whenever you want to, quite honestly. I mean, it's a podcast, for Pete's sake. You can do it whenever you want, because we're all over the place. We're on YouTube and iHeart and iTunes and Spotify and all the major audio places, and also platforms. That's the word I was looking for. Platforms. And also, don't forget, like I said, the Facebook page, like the Beckett's Talking Facebook page, and the Beckett's Talking YouTube channel. Thanks again to Havana Garage and the Old Market. Until next time, take care, and bye, y'all.